I'm joined by Chris Walker, Emergency Preparedness Coordinator for the Hamilton County Health Department. Good Monday morning.
Good morning.
It's been a busy morning. We opened our first vaccination clinic. Tell us how it went this morning.
We did. We went and we've opened up at the 4-H Fairgrounds for folks 80 and over, first responders and healthcare workers. And, barring some very minor hiccups, it went very well. And thankfully, we had a lot of our clients had very positive praise for the efforts we were making. And it's only going to get smoother from here. So quite happy with how the morning has gone so far.
Now, I know that you need to make appointments in order to get those vaccinations. How do our appointments look so far this week? Are we full?
We are pretty much full all week and all next week as well. So people need to be patient. You can look to other locations to get vaccinated. We want everyone to get vaccinated as quickly as possible, obviously, but we all do have capacity limits as well.
Remind people again how they get themselves registered for an appointment.
Sure. The easiest way to do it is to go to ourshot.in.gov. That's OURSHOT.in.gov, or call 211 and they can help you get vaccinated or help you get set up for your appointment.
They can also help you with transportation if I'm not wrong.
211 can. That is correct.
Okay. Well, being that we've had the overwhelming response and knowing that all the folks who have registered now need to come back in 28 days, what are our plans? We're going to have to double capacity, it sounds like.
That's right. We do have to double our capacity. So if we're looking at doing 160 today, 28 days from now, we need to be able to do 320 folks in the same period of time, because we'll still have people coming in for their first shot, as well as our folks from this morning coming back to get their second dose as well. So we're looking at putting on, an extra, essentially doubling the capacity of what we have right now by putting on additional staff and volunteers to make that happen.
Are we ready for that? Do we have everything we need?
We have all the physical space we need. We have all the equipment we need. What we need are more people to help. And the difficult part is understanding that people are volunteering their time, and very appreciative of that is that, with every person that volunteers, we need to create online accounts for them to be able to access the software. And so it really helps if people have a regular schedule that they can work. I can work every Wednesday or every Monday, Wednesday, Friday, whatever that is. That helps us out with scheduling, one, and number two, our accounting and staffing management at the site.
What do those volunteers look like? What kind of experience do they need to be helpful?
We need anyone that can give a vaccine. So medical assistants can at this point, EMTs with basic and advanced qualifications, paramedics, licensed practical nurses, registered nurses, doctors, just about anybody that's got a medical license at this point is eligible to give vaccination.
I know that we're at the mercy of the state in terms of how much vaccine we have. Are they prepared to double capacity for us in 28 days?
That's my understanding, is that they are ready for it. So if Tammy went and got vaccinated today, 28 days from now, there is a vaccine with your name on it ready for you. Now, is it specific for you? Obviously not, but they are accounting for you to get your next dose in 28 days.
And what are we doing to make sure that everybody we're vaccinating today is aware that they need to come back in 28 days?
So when you come in and get vaccinated, there is a 15-minute observation period where we monitor and make sure you don't have an adverse reaction to the vaccine. And during that time, we have folks that are helping reschedule you, so you automatically know when you need to get your next appointment. And the state is sending out reminders to ensure that you do make that appointment in 28 days.
So now we have vaccination clinics going. We still have testing going. How is testing coming?
Testing is doing what testing is doing. We're back to our normal capacity. We had the surge there at Thanksgiving time and through the holidays. So we're seeing more normalized testing numbers, still high, which is good. We want that capacity and we want folks getting tested. So that's going well. Our positive rate is back down to where it was prior to Thanksgiving. And the great news is we're 2 weeks beyond Christmas. And by the end of the week, we will be 2 weeks beyond New Year. So hopefully we will see a pretty significant drop back down, which, as we know, hopefully 7 days later, we will drop back down into orange and get our county status back down and get us back and open up more business, open up more capacity at those places as well.
And now we all know that that's kind of a trickle down thing too, right? So if our numbers start coming down, hopefully our hospitalizations start coming back down, hopefully our deaths start coming back down, fingers crossed.
Well, and that's what we would hope. And that's part of the reason why we started with the 80-year-old and over is the older population is more likely to have a negative outcome if they contract COVID. That includes, more hospitalizations, more time in the intensive care unit, and possibly death. So if we can get the older population taken care of, not only are we protecting them, but we're relieving strain on our healthcare networks as well.
Fantastic. Anything else you want to talk about or add this week as we move forward?
I think, it's great to see everyone coming in and getting their vaccinations, everyone that's willing to get their vaccination and wanting to get it. We need to remember to keep our masks on, keep our social distancing. One shot does not do it. Maximum efficacy happens after your second dose, and it's not immediately after that dose as well. So we still need to continue wearing that mask. And of course, just like any other vaccine, it's not 100% effective. So until we get a large portion of the population vaccinated, we need to plan on continuing protecting ourselves and protecting our community.
Great. Chris Walker, Emergency Preparedness Coordinator for the Health Department. We'll check back in with you next week. Good luck.
Thank you, ma'am.